Welcome to my presentation for today, which is going to be on pregnancy, the complications, the progression of the pregnancy, the baby's growth, and how to take care of yourself. I'm a mom to a daughter, and I can give you the perspective that I had on my pregnancy and the birthing process, which happened in my case. But I'd like you to remember that everybody's birth is different and you might not go through the same process that I did. Just know that your birth is going to be unique, and so I'm going to try and arm you with as much information as I can. So you just found out you're pregnant and you're going to go through a few different emotional experiences. When I became a mom, there was no one there really to offer me guidance and support. Even my own mom didn't. And I just realized that as a society, as moms, we don't really support our daughters when they're pregnant. We don't arm them with information, and we don't really help them too much, which is why I decided to make this video. I just really think that as women and as moms, we just really need to give more support to our daughters when they are pregnant. So think of me as taking the place of your mom and giving you the information you need on what's happening to your body. So I should point out that for many women, pregnancy is going to be a really joyful experience. They feel a sense of excitement knowing that there's life growing inside of them. And if you've just discovered you're pregnant, I hope that this is the experience that you are having. But sometimes women can find out they're pregnant and it can be quite a shock. In my particular case, I found out quite late that I was pregnant. I only found out when I was 20 weeks. And yeah, I had some mixed reactions because I found out so late. I wasn't even aware that I was pregnant. And so you can just imagine I had a lot of mixed reactions about the experience. So you may also have mixed reactions. You can be scared or excited, and that totally depends on your circumstances. If you are alone and pregnant, you may be scared. After all, pregnancy is not really a small thing. I was alone and I knew that the baby's father was probably not ready to step up, so I knew right up front that I'd be looking after my child alone. If you are quite early in the pregnancy, then you have the option to take a pill that can terminate the pregnancy. And let me be clear, while I'm not in favor of termination, I do feel that if you aren't ready to be a mom, then you should consider giving the baby up for adoption or terminating the pregnancy. That's if it's really early in the pregnancy. But termination should not be your first option. Give serious thought to giving your baby up for adoption first before considering termination, because termination really should be the last resort. I strongly suggest that if you're sitting there and you have mixed reactions about being pregnant, you should strongly think about the fact that you might never get the chance to be pregnant again, and that if you want to be a mom, you should grab the opportunity now that you're pregnant, even if your circumstances may not be ideal. I thought about this when I found out I was pregnant, and I decided to go ahead with keeping my child, but I know that some people really are not equipped to be parents and to do it alone, and so it's not a decision that everyone should take. I should also point out that a friend of mine was also single and became pregnant some years after me. She also didn't have a partner that was going to step up and be a dad, but she chose to keep her baby and became a single mom, the same as me. And I'm just going to say here, there's a lot of stigma around becoming a single parent, but I think single moms do some really great jobs of raising babies. And obviously being a single parent isn't easy. You face the very real possibility of doing everything alone. But let's be clear, many married women manage parenting alone in any event, so I don't think you should really feel threatened. So focus on the child. Think about, do you really want to have the baby? Are you ready for the parental responsibility that comes with being a mom? If the father doesn't financially and emotionally support you, will you be able to take good care of your child in every way that the child requires without assistance? If the answer to this question is yes, then you should go ahead and do it. Don't think about what other people are telling you. Don't let them feed you with negative information. you should know whether or not you can do this. And I realize it's unknown, but I think you know yourself. I think it's really different if you have mental health challenges and you know you're battling with that, and now you're pregnant as well. It might make things a lot more difficult for you in terms of coping with a baby and all the responsibilities of parenting. But I think you really know yourself well, and I think you should do some serious thinking before you decide to go ahead. And always remember that if you don't want to go ahead with having the baby, you can always consider giving the baby away for adoption to a good home. So let's move on to symptoms of pregnancy. You may not experience morning sickness or even nausea in the beginning parts of pregnancy. I realize that it's a standard thing that a lot of women do experience, but I can tell you that I didn't. A number of women don't even know they're pregnant until they give birth because of lack of normal symptoms associated with pregnancy. And some women even continue to have a monthly cycle while pregnant. I myself wasn't aware that I was pregnant until I was 20 days along. My tummy was almost flat. I had no nausea. I had no vomiting. I had no tender breasts, and I was stressed. So my already irregular cycle and the stress I was under didn't really faze me too much. I thought that it might just be stress that's causing me to not come on and have my cycle, but I never considered that I was pregnant, and I had no normal symptoms of pregnancy. So it's important that if you answer no to if you feel you can't cope with raising a baby alone, that you consider your options. Because if you know it's a no, then you should really consider the options that are available to you and talk to relevant people that can help you and support you in your process. You should know that your life changes once you have a baby. You have someone else that depends completely on you, and that takes some adjustment. You're going to be the mom and the dad if you choose to be a single parent, and that's no small thing. But if you're committed, you can do this. I know you can because I did it, and I was fine. It wasn't easy, but I was fine. And if you're strong and you're committed, you can do this. If you, as I said, if you have mental health issues, I'd say that being a single parent isn't ideal. And I can speak to this because I have a friend who has mental health issues, and she was a single parent as well, and she really battled, and it's caused some serious issues with her child. And that's something I'll discuss in another video, not in this one. But yeah, mental health issues really do seriously impact your ability to be a parent. So vitamin D is essential to keep bones and muscles healthy. From late March until April to the end of September, most people make enough vitamin D from sunlight. However, October and early March, you should really consider taking a vitamin D supplement. Bear in mind that all around the globe, these times are different, but vitamin D supplements are really important. And in the UK, there's an NHS website which will tell you where you can get vitamin D supplements, and you can check to see if you're entitled to free vitamins. So I as I mentioned, wasn't aware that I was pregnant, and only found out that I was pregnant at 20 weeks. And I just wanted to show you what a normal pregnancy at 20 weeks looks like. The top photos of a lady that's pregnant at 20 weeks. The bottom photo, however, is of my tummy. That was what I looked like when I was 20 weeks. You can see my stomach was pretty flat, you know. So I had no idea that I was pregnant. And it's not unusual for women to carry the way I carry. I mean, it is unusual because most women don't carry the way I carry. But you can be 20 weeks pregnant and just virtually have no pregnancy belly. So yeah, so and you can also have no pregnancy symptoms or no obvious pregnancy symptoms. So it's very interesting when that happens. So let's look at our egg production. A female fetus has around 4 million eggs. When a baby girl is born, this drops between 1 and 2 million, and the number keeps decreasing by 10,000 each month before puberty. So before we even hit puberty, ladies, our egg supply is decreasing. And that's something you should be aware of if you're seriously considering having a baby, because obviously you're producing less eggs, and that's going to influence your ability to become pregnant. So during most menstrual cycles, one of your eggs ripens and is released from an ovary in preparation for fertilization, but the decline in the number of your eggs continues faster than that, and from this time you start your period, approximately 1,000 eggs die each month. That's a lot of eggs, ladies, a lot of eggs. Over the course of a lifetime, your ovaries will release about 500 eggs in their mature form, which isn't a lot. When the supply of eggs runs out, your ovaries cease to make estrogen, and you then start going through menopause. For most women, this happens around the age of 50. The average age in the developed world that this happens is 51.4 years. From this point onwards, you'll no longer be able to get pregnant naturally, and a lot of women, as they age, have various complications and then start considering IVF. In my particular case, I think I have a problem with my ovaries, and so I'm irregular. I have an irregular menstrual cycle. I also think I have an issue with one of my ovaries. So one ovary ovulates one time, and the next time it's very complicated. But just let's say that when you have the issues that I have, falling pregnant is not easy. So let's look at your first trimester. Your first trimester, for those of you that don't know, is basically the first 3 months of your pregnancy. You can see a little diagram there of what it looks like, your fertilized egg, the development of the baby, how the cell division happens, and it's really interesting how the baby is actually fully formed at 20 weeks, which is when I found out I was pregnant. So she was completely fully formed by the time I found out, and I didn't even know she was there. So I want to, before I move on to the various other stages of pregnancy, just talk about an ectopic pregnancy here. There are 2 women that I know of in my life that have had ectopic pregnancies. The one was my aunt. She was unable to have children after an ectopic pregnancy. It must have done significant damage. And then a lady that I knew, a friend, also had an ectopic pregnancy, and she almost died from an ectopic pregnancy. So an ectopic pregnancy is life-threatening. So what happens is the fertilized egg attaches itself to the lining in your uterus normally in a normal pregnancy. But with an ectopic pregnancy, the fertilized egg grows outside of the uterus. And I've given you a diagram here to just show you the various different stages at which the fertilized egg can attach itself, and where it can attach itself when it's not actually in the uterus. So the egg can implant itself in areas like the fallopian tube, the ovaries, even in your belly, or the lower part of your cervix, which is above the vagina. In more than 90% of cases, the egg attaches itself in a fallopian tube, which is called a tubal pregnancy. One study suggests that about 1 in 50 pregnancies in the USA are ectopic. I don't know what the stats are like worldwide. You can research that. But as the fertilized egg grows, it can burst, and it can cause life-threatening bleeding, ladies. So if this happens, you'll need immediate medical care. And if you don't treat it, it's deadly. In fact, ectopic pregnancies are the leading cause of pregnancy-related deaths in the first trimester. So you really need to research what the symptoms are of ectopic pregnancy and realize that you have to get to the hospital right away if you want to save your life. Also, there's no chance of saving the fetus, so the pregnancy will be terminated because that pregnancy can't be saved. So early signs of an ectopic pregnancy include light vaginal bleeding and pelvic pain, an upset stomach and vomiting, sharp abdominal cramps, pain on one side of your body, dizziness or weakness, and pain in your shoulder, neck, or rectum. Please, ladies, this is not something to play around with. If you have any of these symptoms, or if you feel anything strange, head to the hospital, get examined. You need immediate medical care. So let's move on. At 1 month's pregnancy, your baby is an embryo consisting of 2 layers of cells from which all his or her organs and body parts will develop. By week 4 of your pregnancy, this little ball of cells in your womb has grown into an embryo. Although it's only the size of a poppy seed right now, so much is happening. There are 2 layers of developing cells in the embryo, the epiblast, which goes on to form your baby, and the hyperblast, which is a temporary layer of cells that supports the embryo's growth, for example, by creating a yolk sac for nourishment. The embryo is already surrounded by an amniotic sac, which is filled with fluid to protect the baby. And the placenta is in the early stages of development and has 2 layers. Some cells are tunneling into the lining of your womb to provide an oxygen supply from your circulatory system to your baby. And by around week 10, the placenta will be established enough to supply your baby with the nutrients he or she requires, and she'll no longer need the yolk sac. Between week 4 and week 10, all of your baby's organs will begin to develop, and some will even begin to function. So we look at the baby at 8 weeks now. Your baby is now the size of a kidney bean. The first 2 months are when your baby gets ready for the changes, your body gets ready for the changes pregnancy brings. It's also the time when your baby's brain, heart, bones, blood vessels, and organs develop. The sex of the baby and the color of their hair are determined when you conceive and before you even know you're pregnant. Your baby's growing at a faster rate than at any other time in your pregnancy, but they're still really difficult to see without a magnifying glass. Your baby's spine starts to grow very early in your pregnancy, and so you should know that spinal growth and spinal health is driven by folic acid. A lot of spina bifida issues are because of a lack of folic acid, and you should make sure that you get a lot of folic acid so that you can prevent neural tube defects such as spina bifida. So if you're not already taking if you're not already taking folic acid and you're in the beginning stages of pregnancy, I would advise you to make sure you go and get some so that you can make sure that your baby's spinal health is good. And then we look at week 5 to 7. The baby's still tiny but growing quickly. They grow from the size of an apple pip at week 5 to the size of a raisin at week 8. They're starting to look a bit like a tadpole, but the tail will disappear and become the bottom part of their back. And you'll see some babies, people say that they're growing tails, but that's not a tail. That's actually with the part of the spine that actually hasn't fallen away towards the end of labor, that little tail. And usually it's removed through surgery, but that's actually the spinal cord. Your baby's growing from 3 layers. The first layer is the nervous system and brain. The second layer is the major organs such as the digestive system and lungs. The third layer is the heart, blood system, muscles, and skeleton. And by week 5, their heart and blood vessels are just starting to form. And by week 7, their heart's starting to beat. Tiny buds are developing that will become their arms and legs. And by the end of week 8, your baby has tiny hands and feet with webbed fingers and toes, and their lungs have started to grow. By week 5 to 8, you might be starting to feel quite emotional as your pregnancy hormones start to kick in. It's common and normal to feel low 1 minute and happy and excited the next. Some women begin to feel exhausted in early pregnancy, and you may start feeling sick around week 6, although some women go through pregnancy without feeling sick at all. I was one of those lucky women. I had no morning sickness whatsoever. So that was a blessing. So we should look at some complications you might have in the first trimester, ladies. You could have vaginal bleeding, and some spotting is normal during pregnancy, but heavy bleeding can be a sign of miscarriage or ectopic pregnancy. The brighter red the bleeding, the more significant it is. So if you see any of this, just best to take yourself to your gynae or the hospital and just get checked over. You can also have excessive nausea and vomiting. Obviously, some nausea and vomiting is normal, but if it's severe or you feel dehydrated, there's something wrong. if you can't keep any water or fluids down for more than 12 hours, you should call your doctor or get to the hospital. And obviously it goes without saying that if you have a high fever, it's very serious. It could be a sign of infection, which could affect you and the baby. Another thing is vaginal discharge and itching, ladies. Some vaginal discharge is normal, but in some cases it could be a sign of treatable infections or sexually transmitted diseases. And if you have any infection in your vagina, it can negatively impact your baby, so please go and get it sorted out. You could have pain and burning during urination, which can be a sign of a bladder or urinary tract infection, which can lead to serious illness, infection, preterm labor, and preterm birth. So go and get that checked out. Women who have certain pre-existing medical conditions such as thyroid disease, diabetes, high blood pressure, asthma, and lupus should note any changes in their condition during pregnancy. If your underlying disease flares up or isn't well controlled, it can obviously have serious consequences for your health and your baby's. So please keep that monitored and make sure you have that under control. Then you can have leg or calf pain or swelling on one side or a severe headache. This doesn't happen in most pregnancies, but pregnancy can mean that you have a greater chance of developing a blood clot. And a blood clot in the calf may lead to pain or swelling and can result in a blood clot that can travel to the lungs, which can be fatal. A blood clot in the brain may be heralded by a severe headache. And so if you have a history of blood clots or severe headaches, just keep in touch with your doctor, ladies. So your body's going to be going through changes. You may start noticing your hair getting thicker. Foods can start to taste different, and your likes and dislikes food-wise might change. You develop cravings. You might need to go to the bladder more often because your womb's twice the size it was, and it's pushing through the bladder, and it's pushing on the bladder, sorry. Your breasts feel heavy and tender as they start developing the tissue that will make and store your breast milk. So very important for you to take the right vitamins during pregnancy and eat healthy foods. Please avoid alcohol and drugs because they do harm the baby. Don't convince yourself that you can drink just a little or take just a little bit of drugs. Don't do that. You can seriously harm your child. And I've included a slide here. I shouldn't need to say this, but I feel I have to. If you're too weak to stop taking drugs and alcohol during pregnancy, which includes smoking, then you probably shouldn't be considering being a parent. Because parenting is about the well-being of your child, and if you start off being selfish, then you probably don't have the makings of a good parent, and you should probably consider giving up the baby for adoption. I know this sounds harsh, but I've seen the effects bad parenting has on kids, and I know that just because you can have kids biologically, it doesn't mean that you're going to be a good parent. So if you can't make those sacrifices for the well-being of your child, I'm not sure that it makes sense for people that are selfish in that way to have kids. And I'm sorry to say that, but I've seen the effects of bad parenting, and it's tragic. So just so that you understand the effects of alcohol on the baby, there's a normal child's brain, and then there's a child who's been affected by fetal alcohol syndrome. You can see that the brain's a lot smaller and less healthy. These poor little mites that have mums that drink are born with low birth weights, and they have problems with their heart, kidneys, and other organs. They have brain damage. They have learning disabilities. They can be hyperactive. They have attention issues, poor ability to communicate in social situations, poor reasoning and judgment skills. And these poor little mites have really started off life on the back foot because their moms just didn't care enough to make sure that they weren't drinking. So they just held back for the rest of their life. And it's really sad when you think it's just about the mom not doing what she needed to do during pregnancy. So please, don't drink. It's not healthy. Don't convince yourself it is. Alcohol used in the first 3 months of pregnancy can cause the baby to have abnormal facial features. Growth in central nervous systems, e.g. low birth weight, behavioral problems can occur from alcohol use anytime during pregnancy. Just don't do it. Don't drink during pregnancy. Please just don't do it. Then let's talk about moms that smoke during pregnancy. Also, these poor little mites. Every time you light up a cigarette, ladies, your child may as well have the cigarette in its mouth and be smoking it. Don't convince yourself that it's not the fact, because it is the fact. Smoking during pregnancy causes tissue damage in the unborn baby, particularly in the lungs and brain. And some studies suggested a link between the smoking of the mom and cleft lip. And if you smoke, you could miscarry. Your baby can be born too early, have a birth defect, or die from sudden infant death syndrome. Even being around cigarette smoke is bad and can cause health issues for you and your baby. Smoking damages the baby's lungs and brain, and the damage can last throughout childhood and into the teen years. Cleft lips, again caused by smoking, and the cleft lips can cause trouble in eating, and your child might need to have surgery. So smoking during pregnancy causes up to 2,200 premature births, 5,000 miscarriages, and 300 perinatal deaths every year in the UK. Please, just don't smoke when you're pregnant. Don't do it. And don't smoke around your kids either. I mean, it's just unfair. Don't do it. Let's talk about drugs during pregnancy. Taking drugs, and I'm including tobacco and alcohol here, when you're pregnant, even in small quantities, puts your baby's health at serious risk. It increases the risk they'll be stillborn or die in the first few weeks and months of life. And they're very real risks, honestly. And there's a list of opiates, cannabinoids, caffeine, and various different stimulants here that are included in this diagram, and they tell you what effects it could cause, and it's just heartbreaking. Why would you want to put your baby through this just because you're selfish? Don't do it. If you're going to be a mother, the key is being unselfish. Start off by giving your child the best opportunity in life, and that includes looking after their health. So we're moving now to the second trimester of pregnancy, and usually it's most physically enjoyable for women because usually there's no morning sickness or very little morning sickness, and the extreme tiredness and breast tenderness usually eases. Your fetus has now developed all its organs and systems and will now begin to grow in length and weight. In the third trimester of pregnancy, the baby's going to be arriving soon, and you might be feeling a little tired and anxious. I carried small and I had no pregnancy complications, so I didn't have the usual discomfort most women experience in the last months of pregnancy. If you carry in your back, your belly won't be large and distended, which is a blessing. You might be getting a bit of heartburn and indigestion. That's down to your baby growing and hormones affecting your digestive system. Your back will also be under strain due to the extra weight you're carrying around. Your joints and ligaments will also be looser than usual. Your ankles, feet, and face could be puffing out a bit, particularly when it's hot. This is probably due to water retention, but you should get it checked out just in case it's preeclampsia, which is a condition where you might feel well, but your blood pressure can be dangerously high. So rest can help with a lot of your symptoms, so make sure you get lots of rest. So pre-birth, you'll be offered blood tests and your second ultrasound scan at 20 weeks, or you might have had more depending on the risk of your pregnancy. The scans usually look at how the baby is growing and whether there are reasons for concern. You can say no to any of the tests, but I think it's good to have scans because you can pick up if there's anything wrong, and you really want to keep a check on the baby's growth and make sure everything is fine and that you pick up any issues before you give birth. Your baby will drop into the birth canal 2 weeks before delivery. At your antenatal appointment before you're due to give birth, your midwife or doctor will measure the size of your bump. They look for any protein in your urine, which is a sign of preeclampsia. And if you're having a planned cesarean, you'll probably be booked in when you're about 39 weeks. This is to give your baby's lungs the best chance of being fully developed, because babies' lungs only really develop properly towards the end of the pregnancy. And your gynecologist will probably chat with you about what the plan is if you go beyond 41 weeks of pregnancy. Some babies are late, and it's not always a reason to panic. I think babies come when they're ready. But you should be aware that the longer the birth goes on, the larger the baby gets, and there's only a certain amount of room. So the doctor and the midwife might talk about inducing you, and this is where they'll put a tablet or a gel into your vagina to induce pregnancy. And induction is used quite a lot. They wanted to induce me because I was overdue, and I said no, that the baby would arrive when it wanted to, and my baby wasn't in distress. But if your baby is in distress, induction is the way to go, ladies. So before birth, you should be aware there's less room for the baby. You'll also feel uncomfortable, and your waters don't always break when you go into labor. Mine didn't. Mine only broke towards the very end of labor. If you want an epidural, please make sure you arrange this before you go into labor, so that you can make sure that an anesthetist is on call for you. You should also be very aware of breech births. Just so you know, the baby usually presents head first during birth, but if they present feet first, it's termed breech. If your baby is in a breech position at 36 weeks, you'll usually be offered what's called an external cephalic version, where a healthcare professional tries to turn the baby into a head down position by applying pressure on your abdomen. The procedure is quite safe, although uncomfortable, and around 50% of breech babies are usually turned by using this procedure, but not every baby can be turned this way, and sometimes there'll be no way of avoiding your baby being breech. Perinatal morbidity and mortality is higher in cases of planned vaginal breech birth compared to cesarean. And so often what will happen is, if your baby presents as breech and if they're worried, they'll probably recommend that you have a C-section. My daughter had a baby recently. He was breech. They tried to turn him. It was unsuccessful. And yeah, it was very difficult and very painful for her when they were trying to turn him. So it's not easy. It's not easy, and it's quite painful when they try to turn the baby while you're giving birth. But that is what they try to do to actually just minimize the damage to the baby potentially during birth. I survived. So I just want to quickly talk about the risks of breech birth, because I didn't cover that after we spoke about breech. But a major complication of breech presentation is called prolapse, and that's when the umbilical cord drops down below the presenting part of the baby and becomes compressed, and this is quite dangerous. It can other complications are fetal head entrapment, premature rupture of membranes, birth asphyxia, and intracranial hemorrhaging as a result of rapid compression of the head during delivery. So this is the reason why breech births are not regarded with joy. So let's talk about epidurals. I had an epidural during my labor. My labor started at 2 a.m. I had an epidural at 3 p.m. and I gave birth at 9:30 p.m. The actual process of having the epidural, or the injection into my spine, wasn't painful at all. They make you sit on the table and bend over and keep very still, and the anesthetist injects a block into your spinal column. Now, everyone will tell you that the block can't wear off, but that wasn't my experience. Mine wore off towards the end of pregnancy, and this was the reason that I felt my water break towards the end of labor, much to the nurse's horror. And the block was feeding into my spine, but I think my body had just built up a resistance to the anesthetic. Now, ladies, you won't get a medal for going through the labor pains, and if you're exhausted like I was, trust me, labor pains aren't fun. So please, if you want an epidural, have one. Fortunately, the epidural started wearing off towards the end of my labor, and so I felt my water break, and I felt the last part of labor, and I'm fine with that. I didn't have an issue. I was just tired by about 3 o'clock in the afternoon, and it was a relief not to have to feel that 3 to 9 period because I was exhausted. The thing I didn't really enjoy was that because the epidural wore off, I felt them cutting into me with a scalpel when I had the episiotomy, and then they had to sew up my episiotomy, and I felt every single stitch when she was sewing me up with the episiotomy needle. That wasn't fun, but anyway, it was what it was. So ladies, that's the end of my presentation. I hope you enjoyed the presentation. I hope it was informative. Thank you very much for watching. If you would, please can you like, comment and subscribe to my videos. I'm trying to build up my viewership. I've also started a Patreon page. I'll share the details of the subscription. I just want to really say thank you for your support. I hope that my videos are informative and helpful. That's the point and the purpose of them. And thank you for your support.